Well, thanks, dear colleagues. I know everybody's quite tired, but we are trying to do our best to give you some insight into our work of Working Group 3, which is about the undergraduate curriculum in sexual health and sexual medicine. I would like to give you in 5-6 minutes a short overview. First of all, we met and we were agreeing what are the standards of curricula in university education, that it is very important to define the competencies which we want to teach, define the learning objectives, base the program on knowledge, skills, attitudes, define the teaching methods, also the evaluation and feedback and the implementation of a curriculum, which should be accompanied by research. Regarding competencies, we agreed that undergraduate students in medicine and also in psychology should be able to perform a sexual history, including assessment of sexual health risks and sexual concerns, by encourage question and create an open, confidential, non-judgmental atmosphere, following the principles of patient-centered communication and patient-professional relationship based on trust and respect. The undergraduates should be able to counsel patients on sexual health protection and promotion, encourage questions and inform and educate patients and their partners about the basic facts of the anatomy, physiology, and psychology of the human sexual response in women and men and the respective partners, address proactively sexual well-being and sexual function in a respectful, non-invasive manner, take care of patients with sexual problems and concerns in general, as well as in the context of disease, by practicing patient or couple-centered counseling based on proactive, respectful asking, empathy, providing evidence-based information with respect to the problem presented, and by informing patients and couples about therapeutic options and provide referral, know where to refer to if certain interventions are desired. And it is, of course, important to understand that when it comes to communication, it's not only with one person, but it's very often in a dyadic setting. Now, the curriculum is based on these three pillars. It's about knowledge, it's about skills, and it's about attitude. And as I mentioned before, including teaching methods also. So the learning objectives, as far as knowledge is concerned, is the definitions. The students should know and understand the definitions of sexual and reproductive health and rights and diversity of sexuality and sexual cultures, the basic anatomy, physiology, and psychology of the human response, the sexuality-related health risks, the most frequent disorders of sexual well-being, the impact of the most frequent diseases on sexual health and the help available, and know about the specific sexual health needs of sexual minorities and how to respond to them. I'll come back to this in a minute regarding the different topics. Regarding the skills, they should be able to address sexual health issues, as I mentioned before, in a patient-centered, respectful way, address sexual health issues in a couple, considering both perspectives, take a sexual history as part of a general medical and or psychological or mental history, establish a descriptive diagnosis of the sexual health problem, and counsel about solutions to the sexual health problem, and to respond to the specific needs of sexual minorities, which is again a skill. Regarding the attitude, be aware of her and his beliefs, values regarding sexuality and the impact of these on her care for patients, of the large variability of sexual expressions, and develop an open, non-judgmental attitude also by knowing better about one's own perspectives and cultures. We are now still in the process of establishing the knowledge basis about the 8 topics which we are going to talk about in short. This topic 1, sexual health concepts, definitions. Topic 2, the body and sexuality. Topic 3, sexuality and psychology. Topic 4, sexuality-related health risks and prevention. Topic 5, sexual dysfunction male. Topic 6, sexual dysfunction female, or the other way around. Topic 7, medical illnesses and treatment impact on sexuality. And topic 8, sexual health, of minorities. We're going to talk about this a little bit in more detail in a minute. Regarding the skills, and this is what we still have to establish by learning materials, I think you will all agree that very important are communication skills, creating a positive atmosphere with things we know from psychology and communication research, medical communication. I'm not going into this in detail, but you all know about the capacity to listen, to establish a trustful relationship, to use empathy and build rapport, to use open body language, etc., and being aware of the cultural background. Regarding the skills in more detail, I think it is quite important that we establish, based on what is very long known, what is sexual history taking actually. It's about, one part is about risk assessment, you know, the famous 5 Ps. The other part is about well-being, quality of life. And the third part of the interview skill is talking to patients in the context of disease about their sexual health. Um, you know about this. This is CDC, and this is also in other organizations where these practices are taught. You certainly know about the 5 Ps: partner, practice, prevention of pregnancy, protection from STDs, past history of STDs, and additional questions to identify HIV and viral hepatitis. And then the second part, which is uh, very well phrased in the question, what other things about your sexual health and sexual practices should you discuss to help ensure your good health? What other concerns or questions regarding your health or practices would you like to discuss? And here, again, we think it is very important also in what we have heard before, that people are trained how to ask about trauma and violence, and also are trained to support for sexual orientation and gender identity issues with well-established and published questions. And finally, also the issue of sexual concerns, sexual well-being, that this is also part of the training to know how to ask about sexual functioning or interest in sexual activity, which are also well-established questions, also published in the literature. And we have gone also in that context into the work of the US colleagues, which have already worked on this before. Finally, the attitudes. This is actually the part in which cases would be discussed, looking into possibilities to create awareness and reflection on personal beliefs and values towards sex, understanding and accepting the large variety of sexual expression and identification, and understanding ethical principles and ethical issues regarding sexual behavior and sexual expression. So this is the frame. As I mentioned before, we are still in the process. It was not so easy in the context of Corona and doing everything by virtual meetings. So where we are now is actually at the knowledge part. And we will show you a little bit in short fragments what we have for the knowledge part. The skills and attitudes parts, we will have to work on it, and we will need other colleagues to join in also to help us. Thank you for this possibility. And then I would hand over to Gunther Lasdan, who will talk about the topic 1.
And now I would highly appreciate possibility to share my screen. I can talk 1.5 hours or 5 minutes, so your choice.
5 minutes.
Oh, okay. Of course, that was the joke. I hope you see that my slide. Do you? Thank you, Ethel. Your physical activity and body language helps. So first part you have heard today already so many times, and that just confirms that that is so important, that all medical professionals, as well as those involved in sexual health, and there's big variety of different specialties that are at least having the basic plus minus understanding. Human sexuality and sexual health is the first part, and it for this moment it has 31 slides in origin. Don't worry, you will have less. So human sexuality I will not repeat because that has been repeated many times. What I want to emphasize that we have tried in each slide also to have the information where these definitions come from, so that teaching staff, academia can advise themselves and consult. This is a famous, Johannes likes this slide so much, so I couldn't delete it from 31. So, and I think my granddaughter, the eldest one, will for sure like it because of the unicorn. Gender unicorn, so linked to all sexuality issues with gender identity expressions and so on. WHO working definition with all the references, and I will not repeat it again because it has been today several times already repeated. But then the variety of sexual expression, of these different components and in multi-determinants that are actually overlapping and of course having their separate life as well. Key conceptual elements, Johannes just mentioned already them in his introduction, from well-being, holistically and positively, of course, sexual health as such, and then well-being, respect, safety, freedom from discrimination, human rights, independence, of course, the fulfillment of them, individuals' lifespan. It's not only specific age groups, diverse sexualities and forms of sexual expression, critical influences by gender, norms, roles, expectations, and power dynamics. And of course, we are to emphasize the huge, huge role social, economic, and political context plays. This is one slide that, of course, can take quite a while when discussing that with students, but we thought it's important because just to emphasize the complexity of sexuality and sexual health and medicine. I will not go through all slides, but just want to emphasize that additional slides are on positive sexual health, because we are so still used to remember ill health rather than health. So positive sexual health, positive sexual attitude, definition of sexology as such as a medical science and sexual medicine, sexual health promotion, sexual health and its linkages to reproductive health. Remember today Leanne's introduction, she was the person who showed this linkages of blue and orange or yellowish color, and that's where it's also included in our first topic. What professions provide sexual health services in Europe? We try to focus on Europe because if we go globally, then it will be much broader aspects, but still at least focus on Europe. Sexual medicine as a multidisciplinary approach, how to become a specialist in sexual medicine, sexual health monitoring, defining standards, policies, including WHO tools that some were mentioned today. And of course, it should be updated on regular basis. And then not going much longer on individual level. So from very broad systemic approach to individual level, the frequency of sexual health problems in men and women. And remember, it's like a checkup. Whom from all the speakers today already mentioned the example regarding sexual health problems in men and women? Osmo, are you still there?
Yes, I am.
So you see this famous, that's why I deleted the slide, because Osmo already showed this frequency of sexual health problems in men and women from Finland. And we try, rather than to give the theory, just to present the cases of the studies in some countries, so that students, future medical professionals or psychologists can be aware what are reality checks in one or another country. So wishes and needs, explicit model of sex therapy. What should medical and psychology students know about sexual medicine? Sorry, that's how it goes. And last but not least, what should medical and psychology students be able to do regarding patients with sexual problems? And then last slide of mine, it includes 2 slides in our topic of all 31 slides on sexual ethics. We were discussing a lot whether all those principles should be mentioned, but at least this was the main principle that we agreed that it's better to have more and to have a possibility, to leave a possibility for teaching staff to choose rather than to just give few and have like, this is it, and the more than it's up to you yourself. We wanted to help them as much as possible. So with this said, I stop sharing, and I hope I managed in time.
Thank you very much. Thank you very much, Gunther. I think should we have questions directly here for each topic, or what do you think? Should we?
I think we should see all that together, and only because this is, it comes together.
Okay. Then I will go on with topic 2, which I will show you a short overview. It's about the sort of medical aspects, biological aspects. We have the making of the female and the male body, the human sexual response models, the sexual response as a systemic biology approach, and understanding the biology of sexual dysfunctions. These are slides, talking about prenatal differentiation, which might be also interesting for other topics in our teaching. These are slides about the human sexual response models by Masters and Johnson, and then including Helen Singer-Kaplan and Rosemary Basson, just to understand. And this is the issue where we want to go into the organization of the sexual response, which goes from the brain down to the external genitalia. This is sort of a summary slide. We will try to put this into smaller units. And then on the peripheral side, we describe the excitement phase. We describe in male and female the orgasm phase, the resolution phase, and finally, we will try to help them understand that, on each of these hierarchical levels, take the brain, take the hormones, take the autonomous nervous system, take the neurovascular or neuromuscular response. each time you have a balance between sort of excitation and inhibition mechanisms on the brain, different neurotransmitters, on the hormones, different hormones which are prosexual or sexual inhibiting, on the neurovascular level. Sorry. Uh, I was kicked out. Is that correct?
No.
Can you see it? I can't see it anymore.
If you use the up arrow, then you go back to the former slide.
Okay.
Yeah.
Thank you. So, so this is the structure of this more biological oriented topic, to give them basic information about the sexual response cycle and about the different systems which are involved, trying to make it as simple as possible, but at the same time as systemic as possible, because I think this is very important that students understand that this is that the whole body is involved in the sexual response. So that is topic 2. And now I would ask Svetlana to give us a talk or an impression on the topic 3, the psychology and sexuality. I will stop my presentation here. Okay.
Thank you, Johannes. I will share with you the shortened version of our presentation that I've made, because we have as the subgroup 1, as Gunta said, about 30 slides, 33 exactly. So we will run through the most important issues that we covered while working on the subject of psychology and sexuality. And the people who are working on this issue are Marianne, Johannes, Osmo, me, and I added Pierre because he read and viewed and reviewed our presentation. And he said that it was a great one. We also thank him for this and for the suggestions that he gave to us, and we will consider them and include them in our presentation. So at the beginning, we covered the major theoretical perspectives on human sexuality. We covered psychoanalytic theory, Jungian, evolutionary theory, behavior and cognitive approach, social learning approach, and integrative approach. You can see here, I just put the key words because of the time boundaries. I will not go into more details. Also, we covered sex education, which included counseling and coaching to individual sexual health. We defined those three notions: sexuality education, sexual counseling, sex coaching. And after that, we wrote and talked about sexual development, where we covered strands, aims, and stages, and also chronology, the phases and the steps. From the psychoanalytic perspective, maybe we can add something else here. Then we gave an overview and discussed in more detail psychological factors important for sexuality and sexual relations, where we covered motivation for sex. You can see here a lot of different reasons and motives while people get into sexual relationships. And we also put here Mason and Bass study connected with 237 expressed reasons for having sex. Then we included knowing and loving one's own body and the body of a partner. with the key words of how a body functions sexually, how one achieves excitement and orgasm, erogenous zones, body image, liking the body, etc. And after that, we wrote about the interventions focused on the sexual body. Then we wrote about relation with one's own psyche and the psyche of a partner that included a sense of identity with the components cognitive and emotional dimensions. We also, after that, wrote about couple therapy. We defined it, and also about the couple communication training and the couple sex therapy. Then we wrote something about love and passion, the needs and dimensions of a loving relationship and the possible conflicts as well. Then we wrote about the unconscious and sexuality and the most important points related to the unconscious. Then about the sexuality as a creative power, and even more concretely about the sexual fantasies. We wrote about the popular fantasies, then about the fears in sexuality, the fears from psychological harm, and as well the medical threats to sexual health and well-being, and also about the social threats to sexual health and well-being. We also wrote about the psychological difficulties in sex, about sexual inhibitions, and the psychodynamic approach to psychological difficulties, then about the mind-body interaction and about the sexual arousal, about its core themes, processes, and key determinants. That was the shortest possible way to present it. Thank you.
Thank you very much, Svetlana. I would now go back to the topic 4. This was topic 3.
I will stop sharing so that the other person could.
Yeah, okay. Can you? Topic 4. Can you see it? Yeah. Can you see my slide? Hello? Hello?
Yes, yes, we can see it.
Yeah. Now, the topic 3 is about the threats to sexual health and how we can protect ourselves. I'm presenting because we had a little bit problems in collaboration, and so I will basically present a little bit what we have seen. That the big threats from a medical and psychological point of view are unwanted pregnancies, unsafe abortion, STIs, sexual violence, discrimination, and denial of sexual and reproductive rights. Those are the factors that endanger sexual health of people. And these factors could lead to physical morbidity, destruction, infection, infertility, chronic pain, or the medical problems, to mental health morbidity, depression, PTSD, anxiety, but also high-risk behavior, and what we have called sociocultural morbidity, which all can end in different sexual health problems, sexual dysfunction, diminution of sexual well-being. The issue, of course, is that very many of these factors interact with each other. They are connected with each other. And this is important to understand, because if we want to help, we should provide services where these problems somehow are treated together. Now, we have slides going into the impact of unintended pregnancies on the socioeconomic level, but then also on the level of sexual function with loss of sexual desire, sexual aversion, pain, and broken relationships. We give an overview about the importance of STDs, inviting the different countries to contribute their numbers, and we look into the impact of the STDs on sexual health, which is not only morbidity, but it is also sexual pain, it is sexual aversion, and sexual function difficulties. We look at the global facts of intimate partner violence, how the violence itself has an impact on mental health, sexual and reproductive health, death and injury, and of course, again, on sexual function of people. Then we go for the sexual health prevention and promotion, and we come a little bit back to what we have taught before, that the basis is sexual and reproductive rights in a society. The next very important contributor is sexual education. And based on these pillars, then you have contraception, you have safe abortion, you have STI, HIV protection, and you have detection of violence and discrimination and caring for the victims. We would like to teach sexual rights, although it's a long list. And then we give the knowledge we have about what does contraception do, what is available, what are the positive effects on sexual health, what are possible negative effects of different methods. We look into the prevention efforts based on vaccination, safer sex practices, get tested, and post-exposure prophylaxis. We summarize what is known about the care for victims of sexual violence, what is necessary for the services, and what are the care which is given, including emergency contraception, post-exposition prophylaxis, post-traumatic disorder care, and psychological care in general. So this is about the issue of threats to sexual health and the possibilities of prevention and how to maintain sexual health and promote sexual health. This is the topic 4. And now I would like to give the floor to Efi, who will talk about sexual dysfunctions, topic 5 and topic 6. Wait a minute, I have to stop. I have to, oh, somehow now I can.
I think now, I think this is my slides now, right?
Yeah.
Yes.
Okay.
So we did topic 5 and topic 6. Topic 5 is on female sexual dysfunctions and topic 6 on male. So we're going to present them together because we decided that they should have a similar format. So more or less we followed the same structure for both topics. I'm just going to show you the structure and an example. So the objectives of topic 5 on female sexual dysfunctions, we estimated that we're going to use approximately 33 to 40 slides for this. So one objective is to be aware of the most frequent clinical manifestations of female sexual dysfunctions, to know the key aspects of the definitions, to know the evidence-based risks and associated factors of female sexual dysfunctions through a biopsychosocial perspective, and to be aware of the available treatment options for female sexual dysfunctions through a multidisciplinary patient-centered management approach. So these are the general objectives of topic 5. And then for each sexual dysfunction, we had more specific objectives. I'm not going to show you for all the sexual dysfunctions because they were more or less the same structure. So as an example, I'm going to use hyperactive sexual desire in women. So to know the key aspects of the definition for hyperactive sexual desire, about one slide. To be familiar with the clinical presentation of hyperactive sexual desire disorder in women that is not secondary to another sexual dysfunction, and hyperactive sexual desire with arousal disorder, 2 slides. To know the prevalence with age, and to know the most strongly associated organic, psychogenic, sexual, and couple-related factors that explain hyperactive sexual desire disorder, and to be familiar with the therapeutic options, medical and psychological. So more or less, this was the format, the objectives that we followed and we covered for each sexual dysfunction of females. And we did the similar thing for males. So this is the overview of the objectives. It's quite similar to the females, so I'm not going to go through it again. And as an example, I'm using premature ejaculation to know the key aspects of the definition, to be familiar with the clinical presentation of the 2 different types of P, the prevalence and the association with age, again, organic, psychogenic, sexual, and couple factors, and the therapeutic options, medical and psychological. And I'm just going to present to you as an example some of the slides that we got for example, premature ejaculation. We have slides for all the dysfunctions of topic 5 and topic 6. I chose to show you premature ejaculation because Bruno did these, and they were the most clean and tidy slides. So I chose these ones, but we have for everything. So the definition is here, the DSM. Bruno also provided another slide on the ICD, the presentation. So here you can see the questions that somebody can make in order to define the dysfunction, the epidemiological data, and also the association with age. One slide, the risk factors, psychological, I added some data here for the psychological part, the mechanism of anxiety and so on, relationship factors, the somatic and neurobiological risk factors. So everything here concerning treatment on one slide. And there we go, advantages and disadvantages of the different treatments, psychological stuff, and some things for the clinical setting, and so on. So more or less, this is what we got for each sexual dysfunction. That's it.
Well, thank you very much, Efi, for this overview. And then we go, this was topic 5 and 6. And now I would go for topic 7, which is the medical, sorry, I think I have to get back the Bildschirm. Sorry. Well, again, here we are still collecting contributions. The basic structure is that we have tried to look into it, the impact of illness, medical illness on sexuality as a dynamic process, which in the individual patient would depend on pre-existing sexual difficulties, the threat of the disease itself with the therapy-specific factors, the impact then of the disease and treatment on body image, affective reaction, coping and resilience, and the changes in the couple dynamics, which will finally determine the sexual dysfunction symptoms. And based on this, we would then go into the different stages. For example, look what does the disease do to the sexual function on a level of disfigurement, of disability and pain, of sensory dysfunction, endocrine dysregulation, etc. And also what do drugs do on sexual function and sexual health. And the idea is, and this is something I've already produced, but it should be actualized, that we would go to the major diseases, cardiovascular, cardiovascular oncologic diseases, psychiatric diseases, where we have the material together, always based on this structure. What does the disease do to the patient? And also then trying to summarize what are the interventions that that are available to help people in the context of a disease, coping with sexual problems and overcoming sexual problems. That is basic counseling. And then you have the two options, which is on one hand, which are the medical interventions, and on the other hand, which are the psychotherapeutic interventions. So this is the basic structure of the topic 7. And then if you allow me, then I go immediately to topic 8. Again, thank you very much for Dr. Plödel. It was not very, well, I don't want to complain, but yeah, finally, I think we have now a structure which goes basically into looking into what are definitions and prevalence of LGBT, sexual minorities, what is the definition of these gender minorities. Then again, what we have already seen, we think it is very important that students understand these differences in sexual identity and biological sex, gender expression, sexual orientation. We would give some insight in how many are LGBT and the medicalization, a little bit of the history of LGBT, and the political and legal background globally, including these differences between cultures. Legal and protective laws are in place, legal, illegal, etc. And then the focus would be on what are the health threats again, what do our patients or our clients need. Higher rates of HIV, other sexually transmitted diseases, the homophobia, the different aspects in care, the impact on mental health, and this is just a suggestion that we may, look into gay, bisexual, and other men, and lesbian, bisexual, and other women, and really focus on the special needs of the LGBT community, that what they would need as well-integrated services. And this would be a little bit the overview of what we have to fill out, and partially we have already filled out, but I must inform you it's mainly my suggestion. So there is contraception, there is a special needs for trans, queer, and non-binary patients. There is sexual violence, care for victims of sexual violence and discrimination. There is mental health care, counseling, therapy, and social support. There is STD, HIV prevention, testing, early treatment and prevention. And there is the care regarding sexual well-being. This is especially important regarding sexual function after gender assignment operations, or in the context of hormone therapy. I want to take this opportunity really to invite all those colleagues and friends who initially were interested in our working group to encourage them to come back to the work. I think we need to go on with these topics even in more detail, and really make it a high quality. So I would also invite all other colleagues and experts in the different fields to have a look. because this should be a product of continuous evaluation. In the meantime, and I can add this, the Medical Student Association of Switzerland is interested in evaluating the program, and they are also connected to European medical student associations, where there is a great interest in being somehow involved in this project of developing a curriculum. Thank you for your attention, and we are open to questions.